32-year-old female who works as a shop attendant presents to the hospital with intense vulval itchiness and thick whitish vaginal discharge for the last 5 days. This patient reports that the symptoms were of sudden onset, associated with itchiness around the vulva, and then there is burning sensation and discomfort. Now, she also reports of vaginal discharge, which she describes as thick, whitish, and curd-like, and it's non-foul smelling. And she also complains of pain on sexual contact, and also on and off pain when passing urine. There is no any associated lower abdominal pain, and she has had similar episodes of these symptoms like twice for the past year, which were treated with over-the-counter antifungal. There is no any history of recent change in the sexual partner. So what do you think we might be dealing with here? Hello and welcome back. My name is Joseph Tsuma, always your favorite doctor, and when you see me here, you know it is Matters Health. I'm here to bring you trusted health information wherever you are. You can follow me for simple, updated, practical, and reliable medical insights that will be able to keep you and your family healthy. You can subscribe to my YouTube channel at Dr. on Wheels. You can also follow me on TikTok at Dr. Itsuma. So today, I want us to discuss vulvovaginal candidiasis. But before we dive into today's topic, let's listen to some words of wisdom from the book of Psalms, chapter 27, verse 14. And the Bible says, "Wait for the Lord, be strong, and let your heart take courage. Wait for the Lord." Now, sometimes waiting, especially waiting for someone you do not know when they will come, might be a bit challenging, difficult, and sometimes frustrating. And especially when you are trusting in God for something to do for you, sometimes it can be frustrating when you do not know when God will respond to your prayers. But here David is encouraging us that we should wait patiently upon the Lord. Now, the good thing here is that we know that God will definitely come because He has promised. Now, we might not know when, but we have hope and we have the trust that He will show up. And therefore, wait upon the Lord. Do not lose faith. Trust in the Lord. Hold on to the faith because He will come, and He will come to deal with the situation you're trusting Him in. Now, let us dive into today's topic. So what is vulvovaginal candidiasis? So this is a fungal infection that is affecting the vulva and the vagina, and mostly it's caused by candida species. Now, it's a fungal infection caused by mostly candida species. Now, candida albicans is the most common species that causes this type of an infection. Now, it's characterized by itchiness around the vagina, around the genital region, are associated with irritation. So you want to scratch yourself, and sometimes curdy, whitish discharge. Now, around 75% of all women in their reproductive age will be affected by this infection. So it is quite common. Probably someone in their lifetime they will suffer from this infection. Now, around 40 to 50% will have recurrent episodes of candida infection. And around 5 to 8% will develop recurrent vulvovaginal candidiasis, of within a period of around 4 years. Now, we have said that the most common causative microorganism is Candida albicans, but also we can have non-candida vulvovaginal candidiasis, which basically will be affecting around 10 to 20% of the patients. And these non-candida albicans vulvovaginal candidiasis can be caused by Candida glabrata, okay, or Candida tropicalis, or Candida krusei. Now, who are the patients who are at risk? Number one are pregnant women. We talked about pregnant women having a pregnancy as a immunosuppressive condition. So the immunity will go down and therefore they are at risk. But also because of the high estrogen levels. Number two, use of broad spectrum antibiotic for quite a long time. So prolonged use of antibiotics. Number three, immunosuppressive conditions such as diabetes, okay? And specifically here, uncontrolled or poorly controlled diabetes, or immunosuppressive conditions such as HIV, prolonged use of steroids, okay? And then the other thing that predisposes our women to candidiasis is use of oral contraceptives or hormonal replacement therapy, and then wearing of tight clothes that basically prevent good aeration of the genital area, or even poor hygiene, okay? The way you wipe yourself, instead of wiping yourself the right way, basically you can easily contaminate the vaginal area, and therefore you might end up with vaginal candidiasis. And then frequent douching. Now, douching is the use of some chemicals to wash the vagina, okay, or scented antiseptic soaps to wash the vagina. That one basically kills the normal flora, and therefore the bad microorganisms, including fungus, can actually grow and thrive around the vaginal area. Now, let us look at the pathophysiology. Candida is a normal flora in around 20 to 30% of healthy women. Okay. Now, overgrowth basically of this Candida can be caused by immunosuppression. So it occurs when the vaginal flora or immunity is disrupted. So we have talked about use of antibiotics, douching, and all that. That lowers the immunity of the vaginal area. Okay, and this can lead to actually overgrowth of this microbacteria, and therefore this can lead to inflammation, itchiness, and the discharge that comes up with vulvovaginal candidiasis. Now, how do patients present? They will present with intense vulval itchiness, okay, associated with burning sensation and pain on sexual contact, what we call dyspareunia, and sometimes they can also present with pain on passing urine. Now, they will also have thick, whitish, card-like discharge, okay? And then on examination, you might also find some vulval erythema, okay, edema, and excoriation of the skin, and some whitish adherent plaques around the vulva, okay? Now, of note is that it is odorless. This discharge is odorless, so it has no offensive smell. And that one is very important because it helps to differentiate this kind of discharge from discharge associated with vaginosis, okay, or trichomoniasis, or even discharge that is associated with pelvic inflammatory disease. Now, what are some of the complications associated with vulvovaginal candidiasis? Number one is recurrent vulvovaginal candidiasis. And then the second thing is secondary bacterial infection. You know, with that itchiness and, you know, scratching yourself and breaking the skin, okay, bacteria can actually gain access, and therefore it can actually be associated with such kind of complications, okay. Now, the other thing is chronic discomfort, okay, so you cannot stay comfortably in public areas, okay, because of itchiness, or someone has to scratch themselves every now and then, and that one can have psychological impact, whereby someone is stressed, they cannot even go to public functions because of the embarrassment and the itchiness, and sexual dysfunction because of the pain every time you have sex. Sometimes these patients have sexual dissatisfaction, okay, and therefore they will be a bit stressed, okay, and that one can also contribute to the psychological stress. Now, how do you make diagnosis? Of course, a good history and physical examination, okay, so a good history, basically patients will tell you of how itchy and the curd-like discharge, okay, but you can also do microscopy to be able to identify and isolate the yeasts, okay. You can also do gram staining where you basically see the budding yeast, and also you can do culture, which basically is the gold standard, okay. And when you look at the vaginal pH, okay, will be less than 4.5, okay. Now, you can classify vulvovaginal candidiasis into uncomplicated and complicated, okay. So for the uncomplicated, it's sporadic, it has mild symptoms, okay, and mostly it's caused by the candida albicans, and it's mostly found in immunocompetent patients. But now for the complicated, it's severe, okay, it is recurrent, okay. Now most of the time it's caused by non-candida species, okay, and it's as well found especially in pregnant women or women who have immunosuppressive conditions such as diabetes, HIV, you name it, okay. Now, how do you manage? Number one is by far the general hygiene, very important, okay. So good hygiene around the genital area, avoid tight clothing to allow for aeration, okay, and also control in conditions that can easily cause immunosuppression such as HIV, diabetes, okay. Avoid use of drugs that can lower your immunity such as steroids, okay, and by far that will be the best when it comes to management of vulvovaginal candidiasis. But also you can use some medications such as, especially for the uncomplicated vulvovaginal candidiasis, you can use topical azoles such as clotrimazole, miconazole, fluconazole, okay, and for the complicated one you need to use and for the uncomplicated, you can use as a single dose. For the complicated, you need to use them for around 7 to 14 days, okay? So you need to use like the azoles, fluconazole, miconazole, clotrimazole, but this is for up to 14 days. Now, you can use every day for the first 3 days and then a maintenance dose of weekly, okay, around 150 milligrams weekly for the next around up to 6 months. Okay. Now for the non-candida albicans, okay, boric acid suppositories and nystatin has also been shown to be effective when it comes to management of the non-candida albican vulvovaginal candidiasis. Now for pregnancy, topical azoles is recommended and systemic azole is not recommended. So you can use topical azole for up to 7 days. Now, what is the differential diagnosis? Okay, you can get bacterial vaginosis, but then we say that for bacterial vaginosis, it will be false smelling, it will be thick, gray, whitish discharge, which has fishy smell. Okay, and the pH, basically the vaginal pH will be more than 4.5. And then for trichomoniasis, okay, which is the second differential diagnosis, okay, the discharge will be frothy, it will be yellowish greenish, okay, and it will have strawberry, and you will have strawberry cervix, okay. And then the other differential diagnosis is allergic or irritating vaginitis. Now, how do you prevent vulvovaginal candidiasis? We say that you need to avoid unnecessary use of antibiotics, prolonged use of antibiotics, okay? For the innerwears, you need to wear cotton innerwears that basically help with aeration, okay? And then you treat the underlying conditions that can cause immunosuppression, such as diabetes and HIV. And in most cases, most of this infection basically responds so well with the topical antifungals, okay? Now, for recurrent cases, you need a long-term suppression of the disease. And for the non-candida albicans, sometimes they can be hard to treat, but it's possible for them to be treated. Now, if you have found this topic or this discussion very helpful, please consider subscribing to our YouTube channel at Dr. Quills. You can also follow me on TikTok at Daktari Zuma. Until next time,